med school. The last session we have discussed about the relevance of pulse and respiratory rate and a careful examination of these in a neurological problem. Today I'll be discussing about the other important findings in the general examination and vital signs. Let's take the blood pressure. Elevated BP and altered behavior, especially if it is preceded with a headache, think about malignant hypertension. Any patient with a stroke can have a very high blood pressure due to autonomic dysfunction that is occurring, or maybe due to the Cushing's triad. That is, when an intracranial bleeding is occurring, you can get elevated blood pressure, bradycardia. So, patients with a head injury, stroke, always look for these two findings. That is, whether the blood pressure is increasing, especially the systolic BP, and the pulse rate keep a watch on that. So in addition, the BP may be elevated in patients with chronic kidney disease, coarctation of aorta, and that is about the blood pressure. In a obstetrics practice, think about preeclampsia and eclampsia and PRUS. That is the posterior reversible encephalopathic syndrome that can also present with a high blood pressure. Following a seizure, again you may get or a patient has got a distended bladder, a patient with a stroke, again transient elevations of blood pressure can occur. Now we go to the next finding, fever. Fever with headache and altered behavior, think about meningitis, meningoencephalitis. Fever can occur in brain abscess, epidural abscess. Think about infected endocarditis presenting with embolization, atrial myxoma, collagen vascular disease, any vasculitis can present with fever. So again, fever can be a complication of aspiration pneumonia. Somebody admitted with a stroke developing fever, it can be due to various other causes like aspiration pneumonia, maybe thrombophlebitis, pulmonary embolism, etc. Now we look into pallor. Pallor can occur in patients with anemia, and among the anemia, think about B12 deficiency, pigmentation of the hands, knuckles, peripheral neuropathy symptoms, features of subacute combined degeneration, that is spasticity in the lower limbs, and some Stocking glove type of sensor distribution. Think about B12 deficiency. Iron deficiency can lead on to pica, general weakness. Remember pellagra. But again, the manifestation will be the neck lace like skin lesions, that is dermatitis, diarrhea, and dementia. In such cases, think about the other nutritional deficiency along with the pallor. Think for the or look for the nutrition deficiencies, riboflavin, the angular stomatitis, cheilitis, and other nutrient deficiency should also be looked for. Now comes jaundice. Jaundice can occur in liver disease. Somebody coming with altered mentation, hepatic encephalopathy. Fever with jaundice, travel outside, think about cerebral malaria. So, and in pediatric age group, think about the Kernick. Unilateral clubbing can occur in hemiplegia. Cerebral metastasis in a case of bronchogenic carcinoma. Again, you can get the additional other findings also. Lymphadenopathy. Localized lymphadenopathy like a supraclavicular lymph node may be part of the CM, the lung malignancy, or Liverjoh's node, gastrointestinal malignancy. So lymphadenopathy is important, localized, and also so a CA lung may present as a seizure or a metastasis producing a hemiparesis. So examination of lymph nodes are important. Part of lymphoma, part of HIV, the generalized lymphadenopathy can occur in HIV. So careful examination of also patient with the Lambert-Eaton syndrome. That is patient coming with a proximal myopathy, difficulty to get up from the squatting position. It may be due to a lung malignancy, and such case again examination of lymph nodes are important. An epileptic patient with lymphadenopathy, always remember phenytoin phenytoin can produce a pseudo lymphoma-like presentation. Then comes the pedal edema. Pedal edema can occur in heart failure. All of us, we are familiar. Chronic kidney disease, so pedal edema plus volatile metastasis can be hepatic encephalopathy. Chronic kidney disease and the hemiplegic patient can have unilateral edema because of the autonomic dysfunction. The next session we'll discuss about the neurocutaneous syndromes and nerve thickening. Hope it was useful to you. Thank you.